Hey, Warriors. Man, I hope everybody is doing well. We're sitting here on Friday, and I'm just wrapping up my week, and it's been a busy week. So I thought, this is my 5 month or 5th month post op, 5 month, 5th month post op, and I had my checkup with my doctor yesterday at Vanderbilt, Dr. Chang. Guy has been a phenomenal urologist from the day I met him until even up till now. Very thorough doctor. But what I wanted to do is, because I know there's a lot of people just in the Facebook chat that I'm on, or group that I'm a part of. There's a lot of questions around what that 5 month, or it's technically a 6 month checkup. So I'm almost at the 6 month mark, but it landed on the 5th month, so it's 5 months. But a lot of questions in there for people as far as blood work goes, and discussions going on in that meeting, or that follow up. And really, true, my experience, and I a little bit. I hate to say anxiety, because I don't have it. I don't get anxiety. I don't get all worked up about things. But what I did, you get a little stress, maybe a little anxiety, because you're coming up on something, an important moment in your process, or your walk with cancer. So, if you were say undetectable at after surgery, and then now you're coming up on, you do your 30-day checkup, and you're undetectable, and then you go into your 5 month or 6 month checkup, and man, you're just like, gosh, man, you read so many people that they go from that 0.01 to maybe a 2 or a 3 or a 4, and the cancer's still there. And I hate it for those people. I honestly do. So you have a little bit of concern wrapped up in your own visits and stuff. So you're almost living, um, you know, 3 months by 3 months when you're dealing with cancer. But my experience, like I said, a little anxiety, maybe a little bit of stress going into this, and I did realize that it has, over the last probably few weeks, it's definitely affected my day to day, whether it's at work, at home, even if you're not thinking about it. I think it does affect you mentally a little bit, because as soon as I got my results back, and I'll get to that here in a second. As soon as I got my results back, it was just like a sigh of relief, man. It's just like, obviously that gives it away, a sigh of relief, and you're just like, oh man, it's just, man, I was in a better mood yesterday. I was, back to my normal self again. So even though I didn't see it or really feel it, I just thought I was stressed out, and works a lot. Definitely due for a vacation, which starts next week. Um, so everything's good timing. Also helped that we had our fourth grandson. My youngest daughter had her first baby, so we have our fourth grandson. So that helped. So a lot of good things happening this week. So anyway, I'm heading into the day before going to Nashville for my follow up, my 6 month. We'll call it a 6 month follow up. And I'm a little bit anxiety, right? We get there and do my blood work, and it was kind of weird, because you would think they'd do your blood work prior to going to your appointment. Well, at Vanderbilt they don't. So I did have my PSA done a week prior. PSA was a 170, or I'm sorry, testosterone level, because I was curious about that. It's at 173, which is super low. So anyway, go to Vanderbilt. Just so you know, some doctors will have you do blood work prior to maybe a week or 2 weeks prior to your visit. Some do it while you're there, and it all based around the clinic, and how they operate, or I say the labs and how they operate. So Vanderbilt's pretty quick about a turnaround. So I went in, got my blood work done, and then before I made it home, which is about a 45 minute ride, my results were in my portal. So, and then my doctor followed up with me. So don't get too worked up about the blood work, which I was me and my wife both were like, what the hell are we even going for if we're not going to do a blood work? I mean, that's kind of silly. So I did get it. PSA is still undetectable. So excited about that. I got my results, and probably 10 minutes later, my doctor messaged me in the portal and said, "Hey, still undetectable, perfect." And they're not people of many words, but that was good to hear back. So um, let's see, some of the things that were discussed in that were, of course, leakage. If you have any leakage, which I really don't, unless I sneeze or I'm working out, I really don't. And I've cut caffeine out for the most part, so I think that helped tremendously, because caffeine makes that your bladder kind of spasm and irritates it, and of course a diuretic, so it's going to make you have to go to the bathroom a lot. So about 1 or 2 cups a week is what I drink, if I even drink that. I usually drink like 1 cup of decaf, and then I'm drinking water or something along those lines. I don't drink soda or anything like that. Other things discussed in there is obviously erections, and they'll go through all the things of if you're getting them, if you're not getting them, what percentage of fulfillment are you getting, and stuff like that. Be honest with them. I mean, this is a thing, and it's part of the journey that we're on. So, and then they start walking through pumps and shots and stuff like that. And I'll be honest with you, man, giving yourself a shot like that is, I don't know. I've never done it, but uh, I guess we'll see. I guess we'll see. So, you have your options of Cialis and Viagra and all that stuff. And I think most everybody gets put on Cialis or some form of Cialis, I think Tadalafil, or I think it's called. And that I'm on that, but that really helps with the blood flow for recovery. And that's really what it's intended to do. And that's why you're on it. As soon as you get the catheter out, they put you on that to start the blood flow so that you can start healing up. So it'll be a short stint, I think, of Viagra going forward. Pick that up today, and then I'm going to go look into that shot. I don't know, dude. That's going to be something different. And then, because I'm really having some luck, and I hope everybody has the same luck. And I know there's some people out there that just aren't going to have these. Mine was nerve sparing, so there's some hope there. And you see some action, right? It's kind of doing its thing, but at the same time, you still need some help. So the doctor says, if I'm seeing the results I'm seeing now, then more than likely a year out, possibly a year and a half out, may not need any medication. So that's a great thing. But those were the discussions at my doctor visit. Again, they're kind of to the point. They want to get all what they got to get out, and they've got to get to the next patient, and I understand that. I did talk to them a little bit about testosterone, and we'll get into that in another video, because I want to learn a little more about the testosterone, and what that looks like. Don't know. We'll talk about that in another video. But anyway, good visit. I am still undetectable. I'm super pumped. Between having a new grandson, being undetectable, and then I've got vacation next week, much needed vacation. Work can be a stressor at times, but man, I hope every one of you guys are having some good results. If you're not, stay positive. I think some of the best things you can do is, one, if you're going down this road, you need people around you anyway. And then if you're struggling because you're not having the best results, right? Your PSA is going up, or it's back, or it is spread, or you didn't have nerve sparing, and there's just no action going on, or you're having leakage. Man, just stay mentally strong. Stay connected with the people around you. Like I said, that Facebook page that I'm a part of, that group, prostate cancer support group, has been amazing people. There's no judgment on there. It is, and everybody's eager to help. So the important things to me is surround yourself with some positive people that are willing to help and speak into, to encourage you. Not everybody is into going to church or whatever your faith is, whatever your beliefs are. Be strong in your faith, be strong in your beliefs. Mine are, I believe God helps me through all this, plus prayer from everybody at work and home and family and friends, I think has all helped a bunch. And I'd be it'd be bad if I didn't include fitness, man. Some kind of fitness. I've worked out for years. Of course, I've lost a little bit of that muscle and recover and through my recovery from the surgery, but and especially my testosterone's really low right now at 173, so it's really hard to gain some of that muscle back. But I'm still working out. I'm running every I think I run 4 days a week, not real far, still recovering, so it's still a thing, and that cardio, trying to build that back up. So super important, work out, get some exercise. I don't care if you're going for a walk every day, or if you're doing push-ups or sit-ups or whatever that looks like, whatever you can do. Your health, eating right, and getting that heart rate up so that your cardiovascular system is in good shape. Man, if you're getting winded walking to go get the mail, and you're 6 months, a year post-op, man, get out there and do something. It's so important. And if you're watching this video and you're going into surgery, or it's scheduled, or you have prostate cancer, and you don't know what your options are. Maybe you're going to do surgery, maybe you're going to do radiation. Start working out. Start doing Kegel exercises if you're getting surgery. Start walking, push-ups, sit-ups. Man, the better shape you're in going into this, the better shape you'll be coming out of it, and it'll help with recovery. So, hey, I'm going to drop the TRT video probably in another week. So be watching for that. I do try to keep these roughly around 8 minutes because I know people's time is valuable. But I hope they're helping. It don't look like there's a ton of people watching these. Nobody's subscribing or anything, but we'll get there. I know I will. I'm persistent. I'm not going to quit. DFQ, if you've not seen the movie, DFQ, man. So don't quit. Y'all be safe. Y'all have a great weekend, man, and continue being warriors.